So I'm very pleased that the Center for Neurodegenerative Science continues to grow, and we've just in the past few months signed on 2 new full-time professors. Dr. Jerry Coetzee comes from California, and Dr. Vivian Labrie, who comes from Canada. They're both working in a field that's really interesting and new. It's called Neuro Epigenetics. Epigenetics is the set of mechanisms that control the genes, which tell which cell to turn on what gene. And although we don't know for sure that this plays a role in Parkinson's disease, there are several hints that this could be a mechanism that contributes to the disease process. So changes in the way that genes are being turned on and off as we age could be one of the reasons we become susceptible to the disease. Jeff Cordova joined us in January as a part-time employee. His primary appointment and affiliation is with Rush University in Chicago. He's a world-leading expert in brain repair, using new cells or manipulating genes to repair the brain. This is very exciting for me personally because I've known Jeff for over 25 years, but for our institute, now we're launching this program of brain repair in a really, really strong way. ParkinsonNet is a Dutch organization. It's been running for 11 years now. It is designed to provide the best possible care for people with Parkinson's. We're very fortunate through a series of events to have started a collaboration. I know Bas Bloem, who is one of the originators of the net in the Netherlands, and when the Dutch royal couple came here, we jointly signed a memorandum of understanding that we want to bring ParkinsonNet to Grand Rapids and take this Dutch model and adapt it to the US system and help the community here provide the best possible care for all patients. There is an added benefit. By networking patients, it's easier for us to provide them with opportunities to be part of clinical trials, and we can then participate and stimulate these trials. Grand Challenges in Parkinson's disease is a scientific symposium. We've run it for 4 years so far, and this year we're focusing on certain genes that can cause Parkinson's disease, inherited forms, and then on the molecular pathways that are controlled by these genes in an attempt to understand how one might intervene in the disease process. Rallying to the Challenge is a parallel workshop that we organize concurrently, and this is one that gathers patient advocates and people affected by Parkinson's, their families, and we discuss issues that are very important to the Parkinson community regarding clinical trials, how one can measure outcomes, ethics, etc. And this has been tremendously invigorating and powerful because we've had people from all over the world come who are advocates in this area. And it's very inspiring for us as scientists to be in the same event and share experiences. The Link Clinical Trials Initiative is run by the Cure Parkinson's Trust in the UK jointly with us here at the Institute. We are repurposing drugs that are currently being used for other disorders and that have a profile that make them interesting and potentially suitable for disease modification in Parkinson's. So for example, this past year we started a trial with a cholesterol-lowering drug because we think this could actually reduce the rate of cell death in Parkinson's. We are about to start trials with a drug used for diabetes and another drug that's currently being used for the common cough. This is a very interesting initiative because we can cut the whole drug development process by 10-15 years. These drugs are already safe. To the level when they can be funded by the National Institute of Health.
Well, the Van Andel research in Parkinson's means so much to me because of the people that are associated with the Institute. They've all treated me and brought me in as part of the team, like part of the family. That means a lot to me, and they involve me in so much. And Patrick is so driven to find a cure. And we ought to be honored to have such an esteemed institute in our community.